All right, we've launched a referral program for our Clip Notes, and you can win some great prizes. If you haven't heard about it, we launched it last week. We talked about it, but it's exciting. We want to get Clip Notes in as many people's hands as possible. We've gotten such great feedback from you. The summary, the bullet points, the 1 to 4 video clips delivered right to your inbox. You've told us, hey, I don't have time to listen to every episode, but I want to know what's going on. I want to see who you're talking to. And if something catches my eye, I'm going to listen to the full episode. And this is how you do it. This is how you can do it for you. It's how you can do it for your entire team. You hit the referral program and you refer to them. And in the process, you can win some really cool prizes. So what are we giving away? We are giving away a couple things. Let me grab it here. If you get 10 or more referrals, you get this black moleskin notebook. We will send this to you. This is great. I have these with me. I've had these with me throughout my career. Anytime I have an idea or a thought, I write them down in here. As someone once said, the shortest pencil is longer than the longest memory. And that is really true for me. I'm constantly going back to my book to see what I've written down. So we have those for people who get 10 referrals or more. For anybody else, if you get 1 referral, you're going to be put into a drawing. And on January 1st of 2021, we are going to draw 1 lucky winner to receive a work from home kit from This Week in Health IT. And for the person who gets the most referrals, you're going to get the opportunity to come on the show and discuss health IT news with me. And we're just going to go back and forth like I do. You're going to take Drex's seat for 1 week, and we'll talk about whatever news stories you bring to the table and whatever news stories I happen to bring to the table that week. And we're going to have a discussion. The easiest way to participate, to be honest with you, is if you're getting Clip Notes already, there's a refer a friend link in there. But the easiest way is to just send people to thisweekhealth.com, have them click on the subscribe button, and there's a thing right in there for Clip Notes. At the last form field we put in there just last week is referred by. If they put your email in there, you will get credit, and that's how we'll keep track, and that's how we'll determine who's going to be getting the prizes. We're excited about this. We think it's a great program, and we hope that you will refer your friends to it so we can continue to elevate the best thinking and to prepare the next generation of health leaders. Now, on to the show. Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, former healthcare CIO coach, consultant, and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. Speaking of developing the next generation of healthcare leaders, we want to thank Sirius for supporting our mission and the mission of our show. Their weekly support of the show this year has allowed us to expand and develop our services to the community. All right, today we're joined by James Beem, the Managing Director of J.D. Power Healthcare Intelligence, and I'm excited about having this conversation. They did a 2020 US Telehealth Satisfaction Study and just collected a ton of information. And the thing I like the most about it, as James and I were talking earlier, everybody focuses on the payer and the provider. J.D. Power focuses on the consumer, on how people, how patients, how our communities are experiencing telehealth. So excited for this conversation. James, welcome to the show.
Thank you, Bill. I appreciate it. Thanks for having me.
Yeah. So, J.D. Power, clearly we know the name. You guys do a lot of work. Give us a little background on your work in healthcare.
Yeah. So J.D. Power, our business has been in existence since 1968, where traditionally we focused on the auto segment. And if you think about where the auto industry was in 1968 and where it is today, much of the quality of improvement and much of the advancement in auto was driven by consumer preference sentiment, their collective satisfaction levels. So J.D. Power over time has started to move that lens into other industries, which is banking, finance, auto insurance, energy, utilities, and finally healthcare. And so within healthcare, we've been measuring healthcare customer satisfaction over a period of about 20 years now, starting with our largest portfolio, which is looking at private health insurance. But we also measure Medicare Advantage, managed Medicaid, telehealth, dental, vision, group life. We collect that data and we benchmark close to 200 healthcare firms nationally and understanding who is best in class around, customer satisfaction.
So let's talk about this study specifically. So you took a look at telehealth satisfaction. What was the methodology? How did you determine participation, time frame, data collection, those kind of things?
Yeah, so we looked at just about 5,000 US consumers that had a telehealth experience in the prior year. We run them through a series of qualifications. The work that we conduct is online surveys, which in total last about 40 minutes. And the way we divided the work was between payer-sponsored telehealth and direct-to-consumer, meaning consumers that are stepping outside of managed care and working with one of the large telehealth systems. So we have not focused yet on the provider segments. That's something that we're going to be evolving into. One of the tricky parts of this last year when we launched the work in 2019 was finding population that had utilized telehealth. We believe that obviously that's going to change going forward, and we'll be able to draw more consumer sentiment than we did in the past.
Yeah, especially around the provider space, I would think, clearly we know that COVID drove the numbers pretty far up. The methodology change going into next year, will you expand the numbers in some way or just focus a little bit on different areas?
Yeah. One of the things that we have in our portfolio is we measure pharmacy. And one interest of mine is the intersection of retail pharmacy and primary care or health and wellness. And so we know from that specific research that consumers place a high preference and a high degree of trust when they're dealing face-to-face with medical teams, whether that be a PA, NP, MD. And so we believe we are seeing the same level of confidence and trust in telehealth, where if consumers have a face-to-face interaction, whether that's over the phone or visually or some sort of assisted chat, but they're dealing face-to-face with a qualified, physician, satisfaction scores tend to trend very high. So it's in our interest to be able to understand the provider side and how they're introducing telehealth from their systems. Yeah, be on the lookout for that.
All right, so you have, the report's broken down into a handful, at least the summary report that I'm looking at, broken down into trends, drivers, and drivers of satisfaction, and then avenues to increase loyalty and advocacy. Let's just start with trends. What are some of the trends that we saw as a result of your study? What are some trends that you picked up on?
Yeah, so last year was the first year we ran the study in 2019, and we just launched the 2020 version a couple of weeks ago. A couple of trends that we saw was the first thing last year, the issue of safety was not as high of a degree of satisfaction or choice when it came to picking a telehealth provider. Post-COVID, that's become a number 1, 2, 3 area of concern for telehealth members, and they're moving towards a digital platform or a telehealth platform, largely because we see that people probably did not want to go into the four walls of an exam room and found it easier to take care of, whatever condition they had in telehealth. The other trend that we're seeing is that, and this started in 2019, was we were getting a degree of interest and a degree in some regards in dissatisfaction with members or telehealth patients that wanted more complex services as part of their telehealth experience. And they wanted to go deeper into other complex areas, such as treatment for mental health conditions. And we're seeing that in the numbers this year, where they've hit a ceiling. And if they find that they can't get more complex care through a telehealth provider, turns them off in a small way. So.
Interesting. So you did some work around generational, because that comes up a lot with technology solutions. Is the older generation going to adopt it? I know that my mom is 82 years old and she is a telehealth fan. My father-in-law is 88 years old and he is not a fan. I'm a fan at my age, which I'm not going to share. Do the demographics break down like we think they would?
Yes, but there's minor differences. So universally, most of the U.S. consumers we spoke to have a high interest and will consider telehealth. When it comes to actual utilization, that's where it starts to break down, but just a little. So Gen Z, Gen Y exceed 10% usage. But the difference between them and boomers and pre-boomers is only by 2 or 3 percentage points. What we saw when we started to understand satisfaction scoring by population was that the Medicare population actually had the highest degree of satisfaction when using a telehealth service than other populations and other age and gender mixes like that. That was one of the interesting scores here, was that even though the Gen Z tend to be overutilizing telehealth, the highest degree of satisfaction comes with the Medicare segment. One thing we saw last year when we did the 2019 work, which is threading through 2020, is that for those younger generations, Gen Y, Gen Z, the clinical conditions that we saw when we asked them about why they're seeking a telehealth visit tended to trend more towards mental health, behavioral health. And we don't see that in the older populations. We see more classic clinical conditions being sought after.
Yeah, some of that's generational, right? So the older generation maybe doesn't even believe in behavioral health, whereas the younger generation, it's just a different demographic.
Right.
Yeah. So when you look at the things that people are doing across telehealth, are any rising or falling in terms of urgent care, primary care visits? And again, we're not talking during COVID, we're talking just prior to COVID, right?
Yeah, and this is one of the themes that we also measure telehealth within our private commercial health insurance portfolio, and we have been doing that for a couple of years as well. And one of the areas around telehealth adoption and engagement that we see that's almost equal in urgent care is around, convenience, cost, and whether or not the member has enough information from the payer in terms of being driven to that particular, place of service. We often see with consumers, they have a high interest in the service, whether that be urgent care or telehealth, but that connection between the consumer and the ultimate visit is complicated by the managed care benefit network design element of health insurance. And so one of the things we've been promoting with our clients and nationally with not only commercial health insurance, but Medicare Advantage and managed Medicaid, is the payers really have a huge role in telehealth. And that's helping them understand the copay differential, helping them understand how to get access to a telehealth provider, making it more transparent and clear for them. We saw this early in the COVID research that we were doing in healthcare during the spring, where as COVID and the pandemic started to increase in terms of time, the total awareness of telehealth started to rise. The problem was that the same efforts that were being conducted by health insurance companies around helping consumers into a telehealth experience did not rise. And I think that's one of the things that we see with complete similarity between urgent care and telehealth. It's really that steerage of the member, steerage of the consumer.
Yeah, and so you actually touched on this earlier. Most important reasons people using telehealth, safety catapulted up there for obvious reasons, care at a distance, keeping yourself safe. But then the traditional ones were still there, convenience, speed. Do you anticipate that safety will continue to drive telehealth? I'm asking you to interpret the results a little bit here, but it's pretty interesting. On the study, the rank used to be number 11 for safety, and it's now number 1. Do we anticipate that's going to be the primary driver moving forward?
No, I guess if I'm speaking from a position of looking at this from a futurist type of position, I think what's going to happen is that the technology will advance, the promotion of the service will advance. Providers, payers, digital health companies will be offering consumers more complex services under telehealth, which may trump even cost, convenience, safety. I would tend to think that health insurance plans may be developing, or even disruptors, some sort of telehealth entry, managed care entry using telehealth, some sort of digital platform health insurance company where the services are routed outside into the community post telehealth visit. The future's unwritten here. What I can tell you is that of everything that we measure in healthcare, there's a high degree of satisfaction with the telehealth service. 48% of those we spoke to this year and last year had a pretty seamless experience without any technical problems, without any consultation problems. It's amongst some of the most highly satisfying things that we see in healthcare, all the way from managed care up through pharmacy, up through dental, vision services, telehealth at the top. And it's higher when it's being delivered by a health system or a provider. So keep that in mind. Same thing in pharmacy. When a provider is directing the care, consumers put more trust in that particular party.
That's fascinating. All right, let's jump into drivers of satisfaction around this. What are the primary drivers of satisfaction? What leads people to say, hey, this is really good? This is something I want to see continue in healthcare?
Yeah, so we designed a number of KPIs around telehealth, and the number one driver that we saw, which universally consumers were very much embracing and applauding, was that they were able to spend enough time with a provider. That was number one. That made the experience different than driving 20 miles.
So they feel, do they feel rushed when they do a physical visit? Is that it? Or is it just the whole process
Yes.
of going and waiting in a waiting room, getting ushered into a room, then waiting for the doctor, just the contrast of those two things?
No, it's about healthcare literacy, healthcare engagement, spending enough time with a provider to ask the questions and get answers for their clinical conditions. We see the same thing in pharmacy when pharmacy members are able to spend quality time with a PharmD. It's the same element that we see here in telehealth, is that a clear, transparent understanding of the direction that they need in order to satisfy their particular condition. That's very important to the consumers in telehealth here. These run many of the KPIs.
Isn't there a risk here? What we've heard from providers over the years, and this is potentially providers that weren't excited about new modalities and just adjusting their practices and whatnot, but they were essentially saying, look, there's a lot of things you can't do over telehealth. But I would assume if we're running into roadblocks and we're not able to do the things we need to do over telehealth, that would be a huge dissatisfier. Are people experiencing that, or are they essentially saying, no, we're getting to resolution through these telehealth visits?
When you look at sort of the satisfaction on telehealth, you sort of have to compare and contrast the drivers of satisfaction with what is one of the major issues with telehealth. And so the top issue that consumers have in a telehealth consultation, again, it's not the technology, it's not the claim, the reimbursement aspect of it. It is really about the ability to understand the medical professional. And so if that's not achieved in the telehealth visit, there's significant declines in satisfaction. And so the more time you're able to spend with a provider and being able to get a close diagnosis to what your condition is, that is a huge driver of the overall satisfaction. We see this in other areas of healthcare that we measure. It's really around the authentic experience between the patient or the consumer and the practitioner of healthcare.
Do you get any indication as what drives the authentic experience? Certainly, if a telehealth provider is not good with people face to face, they're probably not good with them over a telehealth visit. All you've done is just change the medium. But are there certain factors in a telehealth visit that people said they made eye contact, they communicated clearly, clearly one of them was they spent quality time with me on the call. So are there other factors like that?
Yeah, fewer than 2/3 of the consumers we spoke to experienced a consultation that had courtesy, respect. They were listened to carefully. Things were explained carefully, and gave them the perception that there was value in the actual consultation. So these soft skills, we were not measuring them as hard as we thought we should have, and that's really being elevated. When we first started to conduct the study, we thought it would be about the technical requirements or the cost or the copay mechanisms. We're seeing this in a lot of our healthcare. It is around the authentic consultation between a provider, again, MD, PharmD, NP, PA, and the actual consumer is where there's a high degree of value.
Based on your research, do you think there's going to be potentially, when I'm making a decision next year on what plan to choose, do you think part of that is going to be the telehealth option, that I'm going to want to be able to check that box and have that be a part of my plan? Do you think that will happen?
I think it's early, but I think that we know that when a health insurance benefit is offered in parallel with a telehealth offering, it does provide the consumer a sense that they're getting more value. One of the things that we have measured in our managed care research for decades here at J.D. Power is the the definition of a health insurance member is much different than in other industries. So consider the fact that if you're a banking customer and you have a dissatisfying experience with a bank, you have complete freedom to move to a new bank the next day. In commercial health insurance, Medicare Advantage, managed Medicaid, even pharmacy to some degree, someone else is making a formulary decision, a benefit decision, and making a decision about how you get your health care. And if you have a poor experience with them in June, you may have to wait until October and understand what your new benefit plan is under your employer. So healthcare is far different than other industries when it comes to consumer satisfaction. And we urge health insurance companies that they need to bring more value to the partnership that they hold with health insurance members because of those inherent barriers.
You looked at two segments, direct to consumer, and then you looked at payers. Are there any clear-cut leaders at this point in those two spaces?
So actually the payers significantly jumped year over year in overall satisfaction. That's being driven by their expertise around enrollment, billing, and payment. However, the direct-to-consumer segment is still leading in terms of consultation. Again, those sort of soft skills that we saw before, extending more time with the patient. In totality, they're both highly satisfying experiences, both direct-to-consumer and payers.
Yeah, in the direct-to-consumer space, we have the Teladoc, Livongo mergers top of mind. You have MDLIVE, you have Amwell. We used MDLIVE, I think, at the health system I was at. How do these, is there a clear-cut winner in that group, or is it pretty close when you're looking at it?
And so in the 2020 J.D. Power rankings, Amwell was number one in our direct-to-consumer segment, and Cigna was number one in our payer segment. We saw some challenges with scale and the differences between 2019 and 2020. A little bit more of the technical hardships in 2020 than in the 2019. But in totality, the service levels seem to be equal. But Amwell this year took the top prize, and they had a big, significant jump over last year. I think in some regards, they may have been more suited for scale.
Interesting. Well, let's go to loyalty and advocacy as we, get towards the end of this. I want to look at what's around the telehealth visit. We talk a lot about the physician experience, the physician-patient consultation and spending time with them. And I know all that's extremely important. We've already established that. But what about the complexity of the overall process, the technology aspect of it, the payment aspect of it, the follow-up and connectivity into the workflows afterward? Did that lend itself to either being a dissatisfier or satisfier?
Yeah, so the way that J.D. Power conducts all of their business around rankings and awards and research data and analytics is through our modeling. So we have a J.D. Power index model that is a proprietary built driver of satisfaction, where we understand the consumer satisfaction and sentiment. When we started the telehealth work, we started to field the responses. That's when we go through sort of our data processing. We understand what are the drivers of satisfaction. Then our models are built on that credibility of what the crowd is telling us. So for telehealth, we break it up. 42% of our model is driven by the customer service element of it, which is what is the overall technology experience, the phone, the video. And then the second most important thing, as I mentioned earlier, what consumers are telling us is the actual consultation, the experience that they have with the provider. There we're looking for the quality of the service, timeliness, convenience, what was the dialogue and the experience between the consumer and the provider. And then it's getting into the traditional payer side, which is the actual level of enrollment. How easy was it to find a physician? How easy was it to actually conduct the visit? What was the appearance of the website or the app? The speed of the pages loading, things of that nature. And then finally, billing and payment, which is the clarity of the billing process, the amount of time given to your bill. All of those elements go up into the total satisfaction. And as I mentioned before, the model is heavily built right now around customer service and consultation. And so as time goes on and consumers tell us there's more important things than others, we will weigh the actual credibility of the model. So right now, again, it's focusing on the actual consultation experience and then the customer service element of it.
So I think, and that really answers the question of how do you drive loyalty and advocacy? Well, our loyalty and then people advocating for your program, consumers actually telling other consumers about your program. And you're saying focus in on those core areas, and that is how you drive loyalty and advocacy. Is that accurate?
Exactly. And I would say one major significant finding that we found last year and we found this year is the differences in satisfaction between consumers who tell us that their healthcare is poor and the consumers that tell us that their healthcare is excellent. So we ask a series of questions around their clinical condition. And on a 1,000-point scale, those that said they had a poor condition rated the telehealth experience at a 783. Those that said they had an excellent healthcare or excellent health, their ratings were 900. So we see a 117-point difference between those that are high risk and those that are low risk. And so again, what we know in healthcare is managing poor health populations require more time, more literacy, more engagement. And so I think telehealth has a profound opportunity here to reach into those populations that need greater access around resources, time, education, and overall healthcare literacy. So that was one major point of our data that stood out last year, and it stands out this year as well.
How do people get access to this, to your report and to your data?
Yeah, you can find us under J.D. Power, then look for J.D. Power Healthcare, and there's some links in there and other information, and you'll also find my email in there as well.
So James, you have an interesting background. I want to hit on this before we close. You've had a front row seat in a lot of different things. Can you give us a little bit of your healthcare background, how you got to where you're at today?
Yeah, so I've been in healthcare about 25 years. Started in the traditional managed care health insurance, financial underwriting, actuarial path. I worked at Aetna. I worked for the University of Michigan Health System for a health insurance plan there. And then I was a market chief financial officer at Humana. And right after ACA, I was offered a role within Walgreens as a vice president of outcomes and analytics, where I helped them divest themselves from the primary care space, which is interesting given where CVS, Aetna, and Walmart are these days. And I had a front row seat for that the shift in retail pharmacy over to primary care. And then I was offered a role after IBM entered into healthcare. I was offered a role to become a partner for the newly launched IBM Watson Health. So I got a lot of experience on the provider side, dealing with clinical data, dealing with all of the intricacies that come with things that we know right now in digital healthcare. But one of the things that I was working on at IBM, which held a lot of interest for me, was these massive chess moves around trying to understand the consumer from a data and analytics perspective. And what I found was there was very little understanding and very little data about understanding consumer satisfaction with either pharmacy or Medicare Advantage or Medicare. And it brought me to J.D. Power. And one of our central theses are here is that, there's a lot of decisions made between payers, providers, digital health companies, venture capitalists. There's not a lot of knowledge, not a lot of data around what drives satisfaction, what are consumers really looking for. And we have this massive opportunity in the future around the ambulatory care space. And a lot of consumer decisions are going to be made outside of the traditional incumbent landscape that we have today. So that's what brought me to J.D. Power, and that's what sort of holds my interest in healthcare consumerism.
Well, fantastic. I want to thank you for your time. We'll have to make this an annual visit. You can give us an update on where this is heading. That's all for this week. Don't forget to sign up for Clip Notes, send an email, hit the website. We want to make you and your system more productive. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, HealthLyrics, Sirius Healthcare, ProTalent Advisors, Health Next, and McAfee for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, check out the website, but also check out our YouTube channel. Continue to make adjustments there. Thanks for your feedback on that, and we hope to make that a great resource for you. If you want to support the show, best way to do that, share it with a peer. Participate in the Clip Notes referral program. That's another great way to do it. Please check back every Tuesday, Wednesday, and Friday as we continue to drop shows. Thanks for listening. That's all for now.